luckily we have both varieties in the tutor room, right? So you want to make sure that you go through this thoroughly. All right, so let's start what we can see up at the top here. So here's your ascending aorta. Here's the aortic arch, and then this is the descending aorta. The rest of the descending aorta is covered up by the heart. That's all that you can see of it right there, as it starts to go behind the heart. So you can see the three branches right here and right here and right here coming off the aortic arch. The first one is the brachiocephalic trunk. The second one is the left common carotid artery, and the third one is the left subclavian artery. Brachiocephalic trunk is seen up here as well, and right about here is where it branches into the left, or rather, I'm sorry guys, the right subclavian artery and the right common carotid artery. See how easy it is to get the rights and the lefts confused? You got to, kind of be your own editor as you go through these stations and make sure that you're not accidentally.
Can you point to those again?
What was that? So this is the brachiocephalic trunk right here, and then here, right about in this location, you can't exactly see where it branches, right? But at this point, we can see nearby the right subclavian artery and the right common carotid artery. So the branch point into these two arteries from the brachiocephalic trunk is probably right about there.
Okay, and then that left side.
And then this is all left common carotid artery, which comes directly off the aortic arch, exactly.
Okay.
And then here's, again, the beginning of the left subclavian artery, and here you can see how it continues. All right. So, let's talk about the veins now. So you can only see the internal jugular veins here in this model. So this is the right internal jugular vein traveling alongside your right common carotid artery. And then this is the left internal jugular vein traveling alongside your left common carotid artery. And so over here you can see the subclavian vein. So this is the right subclavian vein and this is the left subclavian vein. And as the subclavian veins converge with the internal jugular veins, they form the brachiocephalic vein. So over here on the right, this is the shorter right brachiocephalic vein, and over here on the left, this is the longer left brachiocephalic vein. And then the right and left brachiocephalic veins converge into the superior vena cava. Let's go down to the abdomen now. So this is your abdominal aorta. We go all the way up at the top. This is a little bit confusing. This is the celiac trunk. You can't see the inferior phrenic arteries here. So this is the celiac trunk. This is going to be the common hepatic artery going to the liver. This is your left gastric artery going to the stomach, and then here's your splenic artery going to the spleen, which does not look like a telephone cord like it should. You should know that that's the spleen, and that's why it's the splenic artery. You can see just a little nub of the superior mesenteric artery, all right, and the reference point is the left renal vein that's flopped over. Okay. Here you can see the gonadal arteries. Here's the right gonadal artery, and then here's the left gonadal artery going to the gonads, and then coming off to the side a little ways down is the inferior mesenteric artery. You can also see the renal arteries, right renal artery and left renal artery. All right, so here we have the branch point at the end of the abdominal aorta, where it branches into the right common iliac artery and the left common iliac artery. And then here very clearly we can see where on the right common iliac artery branches into the right external iliac artery and the right internal iliac artery. And over here on the left, we can see how the left common iliac artery branches into the left internal iliac artery and the left external iliac artery. All right, so now let's talk about our extremities. All right, so let's do the veins first. We'll do the veins of the torso, and then we'll do the extremities. All right, so we got to finish up with the veins here. So traveling alongside our right and left external iliac arteries are our right and left external iliac veins. So this is the right external iliac vein, and this is the left external iliac vein. And then right here and right here are little nubs of our right and left internal iliac veins. So right here and right here is where the external and internal iliac veins converge together to form the common iliac veins. So right here is our right common iliac vein, and right here is our left common iliac vein. And so the right and left common iliac veins will converge together to form the inferior vena cava. And so right here you can see the right renal vein draining into the inferior vena cava, and here's the longer left renal vein draining into the inferior vena cava. You cannot see the gonadal veins, and you cannot see the suprarenal veins. One thing I wanted to point out to you, what's really nice on this model, in lavender you can see finally the hepatic portal vein, which is draining your intestines of nutrient-rich blood and taking it to the liver for processing and detox. And then the liver, right here and right here, will release the processed blood into the inferior vena cava. All right. So these vessels right here and then also here all represent your many hepatic veins. All right. That's where that processed and detoxified blood is then allowed to enter into your systemic circuit via the inferior vena cava. All right. So now we're ready for extremities. Let's start off on the arterial side.
Oh my God.
So I'm going to start off over here on the right because this is the better side for the upper extremity. So here is your right subclavian artery, right, traveling alongside your right subclavian vein. And then right about here, that right subclavian artery gets renamed the axillary artery as it travels deep to your axillary region. And then as it travels alongside your humerus, it gets renamed the brachial artery. And then right here at your antecubital fossa, this is where the brachial artery splits into the radial artery, the more lateral artery traveling alongside your radius, and the ulnar artery, the more medial artery traveling alongside your ulna. Right? And then right here, you can see where both of these arteries spill into your superficial palmar arch, and from there you have little digital arteries coming off. Now let's do the venous side. All right? All along here, all along the entire lateral aspect of the upper extremity, this is all the cephalic vein. Initially, the cephalic vein starts off going alongside the radial artery and then continues at the more lateral aspect of the arm as well. And then going along the medial side, the entire medial side, starting off going off alongside the ulnar artery is the basilic artery. Or rather, I'm sorry, the basilic vein in blue, the basilic vein. And then here's that anastomosis between the two, your median cubital vein where you perform venous puncture. So now up here, you can see how your basilic vein will converge with a deeper vein in your arm to form the axillary vein. And the axillary vein will be traveling right alongside your axillary artery. And then your cephalic vein continues on independently until it finally converges with the axillary vein to form your right subclavian vein, which is right here. And then the same thing will be happening on the left, but it's just not shown at all. It's all been cut away. All right, let's show the arteries for the lower extremity. All right, so you have to imagine that your ilioinguinal ligaments are going to be somewhere like here and like here. All right, you just kind of have to imagine where they are. So over here on the right, all right, it's going to be somewhere around here that your right external iliac artery will become your right femoral artery. So let's just skip over here and say that this is the femoral artery. This is the right femoral artery. And here you can see it's starting to travel behind the femur. And then you have to switch over to the other extremity, the left lower extremity, which is laterally rotated so that you can see the full course of this artery as it travels across the back of the knee joint. So see how the knee joint is tilted out sideways so you can see the kneecap right here? So now you can see on this side, the same femoral artery is traveling now, it happens to be now the left femoral artery though, is traveling behind the knee, and this is where it gets renamed the popliteal artery. So now it's the left popliteal artery, right? And then right here you can see with this first branch point, this is where the popliteal artery will give way to the anterior tibial artery, which will travel across the front of the tibia. You can see it reemerge right here at the distal end of the tibia, and then over the dorsum of the foot where it will yet be renamed again as the dorsalis pedis artery. And then going back up, back to the popliteal artery continues, right, past where it branches into the anterior tibial artery. So it continues as popliteal, 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 popliteal. Stop. And then here's the next branch point where it turns into the posterior tibial artery, which travels alongside the back of the tibia, and then the fibular artery, which will go off to travel alongside your fibula, which is not shown here. Now let's do the veins. All right, so here you can see the femoral vein on the right traveling alongside your femoral artery. And they cut it out for some reason right here. And then past the ilioinguinal ligament, that femoral vein will be henceforth known as your external iliac vein, or specifically the right external iliac vein. And then here it converges with the right internal iliac vein to form the right common iliac vein. You guys can take it from there. Right, and that's all you have to know as far as the veins go.